Since we all know the problem about spaza shops, about food safety, or anything like that, I'm going to play a video where the president was addressing the country. He is going to be talking about the solution, what they are going to do after all these problems. Okay, in the first part of his address, he was talking about the deaths. He was talking about what was the reason why people, the main problem actually that caused maybe the children to actually eat and everything, what they were called. So we all know that information. Mutualedi was talking about it. So let's just listen and listen to exactly what is their solution in this problem. Okay, that is the only support I need from you. Liking, subscribe if you are new, I would appreciate it. Let's get back to the video.
All have a duty as the state, as a society, as parents and families to protect those amongst us who are most vulnerable, and these are our children. Following the special meeting of Cabinet, we have decided to make the following interventions. The first intervention is to get hazardous pesticides off our streets and our shelves. The second critical intervention is to protect children from exposure to these substances. The third critical intervention is to prevent future outbreaks. The following measures will be implemented with immediate effect. To get hazardous pesticides off the street, we now have directed that the spaza shops, which have been implicated in the deaths of children, must be closed with immediate effect. All spaza shops and other food handling facilities must be registered within municipalities in which they operate within 21 days from today. Any shop that is not registered within 21 days and does not meet all health standards and requirements will be closed. The South African Police Service and other law enforcement agencies will be required to investigate, to arrest, and to prosecute offenders. This will involve close cooperation with all registered manufacturers, retailers, and suppliers. Integrated multidisciplinary inspection teams will undertake compliance inspections of food handling facilities, manufacturers, distributors, wholesale and retailers. This will include spaza shops as well as general dealers. Non-compliant businesses and shops linked to any poisoning incidents or found to unlawfully stock hazardous chemicals will be shut down and the law will take its course. A massive campaign of door-to-door inspection of all spaza shops, tuck shops and other informal traders will be undertaken, starting with Gauteng and KwaZulu-Natal. This will be undertaken by interdisciplinary inspections teams consisting of the South African Military Health Services, which did very well during COVID, environmental health practitioners, the South African Police Service, the National Council of Consumers, labor inspectors, and others. The initial phase of inspections will need to be completed within a month. All registered manufacturers of tuberforce will be inspected, that is their premises, to ensure that no products are diverted into non-agricultural markets. The supply chain process for distribution and sale of tuberforce will be investigated to ensure that controls are being adhered to and that there is accountability for who they sell to in the agricultural sector. Regulations and protocols on the traceability, repackaging and distribution and sale of pesticides, insecticides and foodstuffs will be strengthened. The second intervention is about the protection of children from exposure to harmful substances. The Department of Basic Education will immediately issue a circular to provincial education departments and all schools on best practice protocols for preventing and managing foodborne illnesses within schools. By the start of the new school year, the Department of Basic Education and school governing bodies, together with the Department of Health, will review and update the guidelines for schools on the management of suppliers of foodstuffs to all schools. This will include tuck shops operated at these schools and indeed everyone who sells food just outside the school premises. A public education campaign will be launched aimed at children, parents, caregivers, and the broader community on the food safety issues and the identification, the handling, and storage of dangerous chemicals. This campaign will also include the Government Communication Information Service. It will include government departments and agencies. We will also get industry organizations and civil society formations to also participate in this. And this will be complemented by a public education campaign aimed at communities, owners of shops, informal traders, and other retailers on health, safety, and hygiene regulations, and the identification of hazardous products and regulations that apply to hazardous products and the legal consequences if these are not adhered to. Ministers of Basic Education and Health and other government departments will classify certain pesticides and insecticides not suitable for home use or dangerous objects that may not be brought or used on school premises. This will be undertaken in terms of the regulations and safety measures for public schools. The third intervention will be aimed at preventing future outbreaks. I have directed that the joint operational and intelligence structures be established at national and provincial level to deal with this crisis. In dealing with this crisis, our local municipalities will be required to take urgent action to address the problem of rat infestations by cleaning cities and towns and removing waste. All municipal landfills sites will be required to comply with the National Environmental Management Waste Act, and failure to comply will result in strict sanctions that include directives, compliance notices, and yes, enforcement measures. Now, a ministerial health advisory committee is being set up to develop medium and long-term prevention measures. This committee will consist of experts such as toxicologists, pediatricians, chemical pathologists, epidemiologists, forensic pathologists, and others. All deaths of patients who are 12 years and below will now be made notifiable in terms of the notifiable medical condition surveillance system. An electronic medical certification of death will be established to allow the National Department of Health to access cause of death information immediately after a death is certified. The work of the Biosecurity Hub will be strengthened to better control the entry of products, organisms, and harmful biological products at ports of entry. The Department of Agriculture is in the process of reviewing and updating all relevant legislation with respect to the regulation and authorization of agricultural pesticides for use in our country. A joint fund of 500 million rand will be established by the Department of Trade, Industry and Competition and Small Business Development to support township and rural businesses, including community convenience stores. The funding will be for the refurbishment of businesses and non-financial support in terms of technical skills, regulatory compliance, and capacity building. As we undertake these interventions and measures, there is a lot that we can do as parents to protect our children. As consumers and parents, if we buy food or send our children to buy food, it must only be from places that are licensed to sell foodstuffs and that observe food safety regulations. We must make it a habit to check that food is prepared in a clean and hygienic area. We must make sure that foodstuffs being sold have a clear branding and labels. The names of the manufacturers must be clearly depicted, and that they do not have expiry dates that have long passed. We must educate our children about food safety and teach them to check for this labeling themselves. Anyone who sees fake foodstuffs and expired foodstuffs being sold in our communities should report them to the National Consumer Commission. The number for the National Consumer Commission is 012-065-1940. 012-065-1940. We have to take greater care with the storage and the utilization of pesticides and dangerous chemicals, as not doing so has dire consequences. We must only buy pesticides that are in their original containers and that are clearly labeled for household use. All dangerous chemicals must be kept out of reach of children. Spaza shops and street vendors have a special responsibility for the health and safety of their customers. They need to operate responsibly and in terms of our laws. They need to observe certain basic practices about food safety. For example, they must not use the same containers or implements for chemical substances and food. Only pesticides and chemicals registered for household use may be sold. They must be clearly labeled and in their original packaging. Establishments found to be in possession of pesticides that are restricted or banned will face legal consequences. Once again, South Africans are called to work together to overcome this great difficulty that has befallen us. We are far from being helpless, and there is much that we can do when we work together. Each one of us needs to be better informed about the risk of pesticides and other dangerous products. And we need to be informed about the safety of the food that we consume. Each of us needs to take responsibility for the safety and well-being of those around us, particularly the children of our nation. And I do believe that by working together, by enforcing the law, by being alert and responsible, we'll be able to bring an end to these tragedies. Once again, we extend our condolences to the families of the children who have passed away and hope that the Almighty God will give them strength to go through this very difficult period that they are going through.